My name is Iffy. I'm a student of Brandma University. I'm here to do my comprehensive health assessment. First of all, I'll introduce myself to the patient. Hello, Emeka. How are you today?
I'm doing fine.
Why are you here today?
I'm here for my sports clinical.
You're here for a sports clinical. Do you know today's date?
Today's date is Wednesday, February 28th,
Good. What year?
2018.
Okay. Why? Where do you think you are?
I'm in a clinic.
Good. So Emeka is a 15-year-old boy who came in today for his physical. He is the chief source of information. He was not referred by anybody. He is alert oriented, therefore and he provides information freely, therefore his information is reliable. His chief complaint is here for sports clinical. History of present illness. He doesn't have any illness. He is just here because he's a basketball player. He requires annual sports physicals. He is not allergic to any medication. He is not on any medication. Past medical history. Emeka is healthy, does not have any medical history, has never had surgery, has never been hospitalized, does not have any psychiatric history. Family history. Emeka's maternal grandparents are still alive and they're in their 90s. Maternal grandfather has hypertension, maternal grandmother has diabetes. Emeka's paternal grandparents are still alive. They're in their 80s with no medical health problem. Emeka's parents are in their 50s. Dad is 51, mom is 50. Dad has history of hypertension. Mom has no medical health problem. Emeka is the second in a family of 4, has 2 sisters, 2 brothers, all are still alive, no medical history. Emeka does not have any child and he is in good health. General survey. Emeka is well groomed, a little bit overweight. He's alert oriented ×4. He has good posture, not in any physical distress. He looks well groomed and well nourished. We'll now start the head to toe examination. So we're going to start with okay, Emeka, I forgot to ask you. Do you have problem with school? Do you mix well with people in school?
Mm-hmm.
Do you bully anybody or does anybody bully you?
No.
Okay. Do you drink alcohol?
No.
Do you smoke cigarettes?
Never.
Does anybody in your family smoke cigarettes?
No.
Good. Do you have guns at home?
No.
Do you know how to use a gun?
No.
Good. So I will start with the head to toe exam. So I will start to inspect the patient from head to toe. His head appears normal. His face appears normal. He has a scar on his forehead. How do you get your scar?
My cat scratched me.
Next time you play with your cat, you have to be careful. I'm going to palpate his face. Do you feel any pain?
No.
Good. Oh, sorry, I'll start with the skull. I'm going to palpate the skull. He has evenly distributed hair. There's no signs of infestation. The scalp is easily movable. There is no sign of bump or any bruises. I'm going to inspect his face. Face is symmetrical. His ears is in the same size, in the same level on the opposite side. His brows are on the same level. The eyes are on the same level. Just looking at the face, there's no deformity that I can see from the phone. So first, I'm going to start palpating the face. Do you feel any pain?
No.
Good. Next, I'm going to palpate his frontal sinuses and Edmondo and maxillary sinuses. Do you feel any pain?
No.
Any tenderness?
No.
So there's no tenderness on his sinuses. Then I'm going to assess his 7th cranial nerve. Can you smile? Puff out your cheek. Can you close your eyes tight? Can you look surprised? Can you frown your face? So his face is symmetrical while he did this. His cranial nerve number 7 is intact. I'm going to palpate his temporomandibular joint. Emeka, can you move your teeth from side to side? Can you open it up and down? Good. Next, I'm going to check for sensation on his face. Emeka, close your eyes. Do you feel anything on your face?
Yes.
What do you feel?
Comfortable.
Tell me when you feel it. Close your eyes.
Now. Now. Now.
Good.
Now.
So his cranial nerve number 5 is intact. There was no popping on the jaw when he moved his jaw, and he's able to feel the sensation on his face. So I'm going to move over to eye examination. First of all, I'm going to inspect his eyes. So just looking at his eyes, both eyebrows are the same level. Can you close your eyes? Open it, not tight, just close and good. He has no ptosis in opening his eyes. They open evenly and close at the same time. So I'm going to look at his conjunctiva. Look, okay. His conjunctivas are pink and moist. There is no sign of jaundice or paleness. So the sclera is white. So I'm going to look at the back of his eyes. Okay. Okay. Good. Emeka has two good red reflexes in his eyes. Emeka, please close your eyes with one hand. Can you read what you see here?
LTFPH.
Good. Can you close the other eyes? Can you read?
LTFPH.
So patient has good visual acuity and his cranial nerve number 2 is intact. I'm going to check for response to light, both direct and consensual. So patient has both consensual and direct reaction to light. I'm going to check for accommodation. Emeka, can you look at my shoulder? Patient has good accommodation. Now, I'm going to check the ocular extra movement, EO, extraocular movement. So, which is test the cranial nerves number 3, 5, and 6. Emeka, I need you to follow your eyes with this. Don't move your face, okay?
Okay.
So, good. So I'm going to look into the patient's ears. Patient has intact 6, 3, 5, and 6 cranial nerves. Okay, so I'm going to inspect his ears. There is no swelling or tenderness. I'm going to palpate. Do you feel any pain?
No.
No? Good. So I'm going to look into your ears, okay?
Okay.
Good. So the tympanic membrane is intact, fiery gray, and the ear canal is patent. Good. So the left ear has a little bit of the left ear has a little bit of wax, but it's patent, and his eardrum is fiery gray and intact. So I'm going to do the Rhine test and the Weber test to test for the 8 cranial nerve. So Emeka, I'm going to hit this and put it on your forehead. You tell me if you can hear it in both ears, okay? Can you hear the vibration in both ears?
Yes.
Good. So I'm going to hit this, put it on the bony prominence behind your ear. You tell me when you stop hearing the vibration. I'll put it in front and you tell me when you stop hearing the vibration, okay?
Okay. No. No.
Good. So air conduction is twice as bone conduction.
No. No.
So bone conduction is twice as air conduction in both ears. So the eighth cranial nerve is intact. Next, I'm going to look at the patient's mouth. I need a spoon. I need a spoon for the tongue. Yeah, thank you. So next thing I'm going to look at actually is the patient's nose. Okay? Yes. Good. Okay. So the nose is patent. There is no drainage on the nose. There is no the nasal mucosa and the turbinate are pink and moist. There is no signs of infection or swelling or congestion. The next thing I'm going to look at is the patient's mouth. Emeka, I need you to open your mouth.
Okay.
Patient has good oral hygiene. There is no foul smell. There is no, let me see your teeth. There is no signs of dental caries. There's the oral mucosa is pink and moist. There is no ulceration or sores or blisters on the gums and there is no soreness or blisters on the gums and oral mucosa. Then the next thing I'm going to do is to look at his uvula at the back of his throat. Open your mouth. Say ah.
Ah. Ah. Ah.
His tonsils are +1. They are pink and moist. His uvula is centrally situated and moves down centrally during speech. There is no postnasal drip. There is no signs of infection or swelling of the tonsils. So the next thing I'm going to look at is I'm going to check his gag reflex. Amika, open your mouth.
Ah. Ah.
Good. His gag reflex is intact. So that's his 9th and 10th cranial nerve are intact. Now I'm going to check for 11th and 12th cranial nerve. So Emeka, move your head against my hand. Good strength, 5/5. Good. Shrug your shoulder. Good. So his 11th and 12th cranial nerve are intact. Next, while we're still on the neck, I'm going to check for the movement of the head. Emeka, can you move your head back, down, touch your chest with your chin? Good. Okay. Can you move your head this way? This way? Good. Do you have any pain on your shoulder?
No.
Okay. So while we're still on the neck, I'm going to listen to his carotid arteries. Okay. Good. I'm going to palpate the carotid arteries. Good. So his carotid arteries, there is no bruit on his carotid artery. They are +2 and strong and full. I'm going to palpate the rest of his neck. I'm going to palpate his thyroid. Emeka, can you swallow? Good. So his thyroid gland is smooth. There is no signs of nodule or signs of thyroid problem. I'm going to palpate his lymph nodes. So there is no signs of swelling or signs of any problem with his lymph nodes. And like I said, his carotid arteries, there was no bruit on his carotid arteries, and there is no I'm going to auscultate his thyroid for any bruit. So there is no bruits on his thyroid. So I'm going to move over to cardiovascular and respiratory assessment. So Emeka, I need you to turn your back. Hold on. Let's put the chair this way. Okay, this way. So, okay. So just looking at his back, there is no abnormal curvature of the spine on inspection, and the skin is smooth. He has good distribution of hair. There is no scars, no any signs of abnormality with his skin. So now I'm going to palpate his chest wall for any problem. I don't see any swelling or any mass or any nodules. Next, I'm going to palpate for tactile fremitus. Emeka, say 99.
99.
Say 99.
99.
Say 99.
99.
Say 99.
99.
Good. Good resonance. And I'm going to percuss. So there is no good resonance on his percussion. I'm going to check for costovertebral angle pain. Any pain?
No.
Any pain?
No.
Good. So there is no costovertebral tenderness. So I'm going to check for chest expansion. Emeka, breathe in, out, breathe in, out. Good lung expansion. I'm going to percuss the posterior wall for diaphragmatic excursion. Here's the marker. So I'm going to percuss from areas of resonance to areas of dullness. Okay. Now I'm going to percuss from areas of dullness to areas of resonance. And I'm going to do the same on the other side. Oh, you know what, Emeka? Sorry. Take a deep breath and hold it. Hold it. Okay. Now, take a deep breath Let it out. Hold your breath. So I'm going to percuss from areas of dullness to areas of resonance. So I'll do the same on this side. So Emeka, take a deep breath in. Hold it. I'm going to percuss again from areas of resonance to areas of dullness. Okay, Emeka, take a deep breath. Blow it out. Hold your breath. Now I'm going to percuss from areas of dullness to resonance. And I'm going to measure. So patient's diaphragmatic extraction is 4 cm in length, which is good. Next, I'm going to listen to his long sounds. Okay. Breathe in and out. 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 Patient has good lung sound, a clear breath sound in all areas of the lungs posteriorly. Now I'm going to do his anterior chest. There is no adventitious lung sound. Emeka, can you turn around, please? Quick. So now that he's turned around, I'm going to assess his upper extremities. I'm going to palpate for joint pain. Do you have any joint pain?
No.
Just inspection, looking at both upper extremities. Both hands are equal. There's no signs of muscle weakness or anything. Good. So I'm going to palpate his radial pulses. Radial pulses are +2. I'm going to also palpate the brachial pulses. Sorry. Good. The brachial pulses are +2, and I'm going to assess his fingers. His fingers are good. They are well trimmed, and capillary refills is less than 3 seconds. Good. So I'm going to go ahead and look at the rest of his chest. So first of all, I'm going to palpate his chest. Do you feel any pain?
No.
Good. So I'm going to palpate for tectal premises again. Can you say 99?
99.
99?
99. 99. 99.
Good. Patient has good tactile premises. The next thing I'm going to palpate is for breath sounds. Okay. Emeka, breathe in. Breathe in. Breathe in. Breathe in. Good. I have vesicular sounds on all areas of the lung. There is no adventitious sound. So next thing I'm going to do is to palpate for point of proximal PMI. His PMI is located at the mid-clavicular line, 5th intercostal space, and his heart rate is about 82 beats per minute. Next, I'm going to listen to his for his heart sounds, and I'll listen both with the bell and the diaphragm of the stethoscopes. So I'm going to listen to the aortic at the 2nd intercostal space, pulmonic at the 2nd intercostal space. I'm going to listen to the Erb's point at the 3rd intercostal space. I'm going to listen to the tricuspid at the fourth intercostal space, and I'm going to listen to the mitral at the fifth intercostal space. Heart sounds 1 and 2 were heard. There is no abnormal abnormal lung sounds. Emeka, I need you to get onto the bed so we can do the rest of the examination. So as the patient is lying down, I'm going to check. Emeka, can you sit a little bit? Okay, this way. I'm checking for his jugular JVP. Thank you. Emeka, sit down. You can lie down now. So now I'm going to do the abdominal examination. Just by inspection, his abdomen is flat, is rounded, and there is no, visibly looking, there is no bulging, there is no scarring. Have you ever had surgery before?
No.
There is no surgical scar. So next, I'm going to listen to his I'm going to listen to vowel sounds. The vowel sound is active, normal active in all 4 quadrants. Next, I'm going to listen to the aorta. There is no bruit had over the aorta. I'm going to listen to the renal arteries. I'm going to listen to the iliac arteries. I'm going to listen to the femoral arteries. There is no bruit had over the renal, the iliac, and the femoral arteries. Next, I'm going to percuss the liver. I'm going to percuss from area of tympani to area of dullness. I'm going to percuss from areas of dullness to tympani. And I'm going to measure. Patient's liver measured, liver span is 6 cm. Next, I'm going to do light palpation. Do you feel any pain anywhere?
No.
Good. Now I'm going to do deep palpation. Any pain?
No.
Okay. I'm going to palpate the liver border. The liver border is 1 cm below the right costal margin. I'm going to palpate for the spleen. The spleen is not palpable. Now I'm going to palpate for the kidneys. I could not palpate the kidneys. I cannot palpate the kidneys either on the left side. I'm going to check the Murphy's test. Breathe in, out. Do you feel any pain?
No.
Negative Murphy's sign. I'm going to do the psoas sign. Move your leg up against my hand. Do you feel any pain?
No.
So psoas sign is negative for appendicitis. And I'm going to do the obturator sign. Make a move, flex your leg. Okay. Do you feel any pain on your stomach?
No.
Good. On your tummy, abdomen?
No.
So the psoas sign and the obturator sign are all negative. Emeka, thank you. I need you to sit up. Sit up. So I'm going to look at the lower extremities. Just looking at the lower extremities, both legs are equal. He has even skin distribution. on his lower extremities. I'm going to check for peripheral, for capillary refills. Emeka, do you feel any? Oh, sorry. The capillary refill is less than 3 cms. I'm going to check for his pulses. His popliteal pulses are +2. Okay. I'm going to palpate the pedal pulses. Okay. They are +2. Emeka, I need you to move your knee up. Okay. So, I need you to move your feet against mine. So, patient has strong muscle strength. Okay, move your, okay. Don't let me move your leg out. So, patient has +5/5 muscle strength on lower extremities. Then, I'm going to check for sensation. Okay. So, tell me what you feel. Close your eyes, okay? Close your eyes.
Humble. Needle. 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 Humble.
Good. Close your eyes still. Tell me what you feel.
Humble. Needle.
Sorry.
Humble. Needle. Needle. Humble. Needle. Needle.
Patient has good, we are doing the neurological. Patient has good sensation. Emeka, close your eyes. Close your eyes. Give me your hand. What did I write in your hand?
Needle.
Close your eyes again and tell me what I wrote in your hand.
Needle A.
A, good. Close your eyes. Tell me what you have in your hand. Close your finger.
Needle.
Needle, good. And this one, close your, so what do you have?
Needle.
Good, good. So, I'm going to check your reflexes, okay? First of all, I'll check the elbow reflexes. Good. Move this. Good. Patient has both good elbow reflexes. Yeah. Okay. Patient has +2 reflexes in his deep tendon reflexes in his upper extremities. I'm going to do the patella. Yes. Good. Good. I'm going to check for Babinski's reflex. Good. Negative Babinski's reflexes. Patient has good reflexes all over both upper and lower extremities. Emeka, get down. So, can you move your hand up, down? Put your hand against your head, like this, down. Can you turn this way? Turn this way. Okay, here. Can you move backwards? Good. Sorry. Can you touch your toes? Good. Can you squat? Good. Can you walk on your tiptoes? I'm sorry. Okay. Can you walk back on your heels? Good. We're going to do some range of motion tests for the upper extremities, okay? So, can you do your elbow like this? Okay, good. Can you move your hands out like this? Take them in, move them this way, out, this way, out. Okay, we're going to do, I need you to touch your head and point my finger. Touch your nose and point to my finger. Do it very fast. Keep doing it. Keep doing it. Keep doing it. Good. Bring up your arm. Don't let me push it down. Good. Easy. Okay. Don't let me push it down. Good. Don't let me push it out. Don't let me push it in. Patient has good muscle strength in his upper extremities. Now we're going to do the drop count test. Okay, for your shoulder, stretch out your arm. Keep it this way. Keep it this way. Turn it upside down. Okay. Don't let me push down. Great strength. This arm. Good. Turn it down. Don't let me push down. Good. I'm going to do the apprehension test. Okay? Put your arms down. Good. Okay. Good. Emeka, bring it up like this. Watch I need to see your face. Look at my face. I need to see your reaction. So there is no apprehension reaction with the shoulders. Another thing we are going to do is we're going to do the drop. We did the drop. Okay, drop arm test. Okay, stretch out your arm. Okay. Can you bring your arm down? Bring it. Okay, let's do it on this arm. Can you bring your arm down? Good. We're going to do the felling test for the fingers. Do this. Okay, good. Do you feel any tingling sensation?
No.
Okay, we're going to do the toenails test. Do you feel any sensation?
No.
Do you feel any sensation?
No.
We're going to do the apprehension test. Look at me, see? Put this arm down and touch it with this finger. Good. Let's do it on this arm. Bring this arm over. Hold it with this finger. Good. Patient has good rotation, internal and external rotation on both left and right shoulder. I need to do a couple of more tests. I need you to get on the calf for your knee. Lie down on flat. Lie down flat. So I'm going to flex your knee. How many minutes do we have? 37, 3 more minutes. So I'm going to do the drawer test. Okay. Do you feel any pain or tenderness?
No.
Good. Bring that one down. Emeka, bring this one down. Flex this leg. Do you feel any pain or tenderness?
No.
Good. So the next thing I'm going to do is the valgus and varus test. So here, to Emeka, I'm going to flex this knee. Okay. Do you feel any pain?
No.
On your knees?
No.
Okay. So this is the valgus test. I'm going to do the varus, which is the opposite. Do you feel any pain?
No.
Good. I'm going to do the I did the anterior drawer, I did the Apley test, I did the apprehension, I did the valgus and varus test, and that concludes. Emeka, thank you. You can come down. Thank you. That concludes our comprehensive assessment. Thank you for watching.